Welcome to The Explainer. So today, we're going to talk about something called heart failure. And right off the bat, I want to be clear. It's not about the heart just suddenly stopping. It's really the story of a heart that's been struggling, working under incredible strain over time.
So just to give you a sense of how big this is, let's look at this number, 5.1 million. That's how many people in the US alone are living with heart failure right now. I mean, that's a huge number, right? And what's wild is that it's actually growing.
Okay, so what do we actually mean when we say heart failure? The name itself is kind of misleading, you know? It doesn't mean your heart has just quit. A better way to think about it is like a pump, a really important pump that's just not strong enough anymore. It can't get the job done and supply the whole body with all the blood and oxygen it needs to function.
So here's how we're going to break this down. We'll start with what it is, then get into the two main types. After that, we'll look at this crazy way the body actually makes things worse. Then we'll cover how doctors figure it out, and finally, how we manage it.
All right, section 2. Let's dive into the two main types. You can almost think of them as two different characters in this story. You've got the heart that's too weak to give a good squeeze, and then you've got the heart that's too stiff to even fill up properly.
So how do you tell these two apart? Well, it all comes down to this really key measurement called the ejection fraction, or EF for short. Think of it like a power rating for your heart's pump. If that number is low, say 40% or less, that points to the weak heart problem, what doctors call HFEF. But here's the tricky part. What if you have all the symptoms, but the EF number looks normal? Well, that points to the stiff heart problem, or HFpEF, where the heart just can't relax and fill up like it's supposed to.
Okay, now this next part is, honestly, it's fascinating but also pretty scary. It's all about how the body, with the best intentions, tries to help, but ends up getting trapped in this really dangerous, vicious cycle.
Let's walk through this because it's so important. Step 1, the heart starts to struggle and its output drops. Okay, so the body senses this and basically hits the panic button. That's step 2. It floods the system with stress hormones to try and compensate. This leads to step 3. The blood vessels tighten up and the body starts holding on to salt and water. Now you can see the problem, right? All of that extra fluid and pressure puts even more strain on the already struggling heart. And over time, this constant stress physically changes the heart's shape. It gets weaker, it gets bigger, and that's a process called remodeling. And that just makes the heart failure worse. And the whole vicious cycle just keeps going.
So with all this going on inside, how does a doctor even begin to diagnose it? Well, they kind of have to be detectives. They start looking for clues, and the biggest clues come from figuring out where all that blood is backing up because the pump isn't working right.
And it really depends on which side of the heart is having the most trouble. So if it's the left side that's failing, the traffic jam of blood backs up into the lungs. That's where you get symptoms like shortness of breath and coughing. But if it's the right side, the backup happens in the rest of the body. You'll see things like swelling in the legs and ankles. And, a lot of the time, it's actually a mix of both.
Now, to be sure, doctors have a whole toolkit, but the real MVP here is the echocardiogram. It's basically an ultrasound of the heart. It lets them literally see the heart pumping, check out its size and shape, and, this is the big one, it lets them measure that ejection fraction we talked about. That's how they know for sure which type of heart failure it is. Once the diagnosis is made, the next question is, how severe is it? And for that, they use this classification system. But what I want you to notice is that this isn't about lab numbers. It's about real life. Someone in class 1 might not even notice it. But by class 3, just doing something simple like walking to the mailbox could leave you breathless. And in class 4, you can have symptoms without moving at all, just sitting at rest.
All right, last section. So what do we do about it? How does medicine step in to help? The really important thing to understand here is that the goal isn't just to make the symptoms go away. It's about supporting the heart itself and trying to bring the whole system back into balance.
So therapy has a few big goals. Yeah, of course, you want to improve quality of life and reduce symptoms. But it's also about preventing hospital stays, slowing down the progression of the disease, and ultimately, prolonging life. It's really a long-term management plan.
And this is where it all comes full circle. Remember that vicious cycle we talked about? Well, the best treatments we have today are designed specifically to break it. They're not just a Band-Aid. They are a direct, strategic counterattack against the body's own harmful overreactions.
For the weak heart, HFEF, doctors now have this amazing team of medications. You've got things like ACE inhibitors that relax blood vessels and take the strain off. You have beta blockers that act like a shield, protecting the heart from all those stress hormones. And then there are newer classes like SGLT2 inhibitors, which are great because they protect the heart and the kidneys. It's all about working together to lighten the load. Now, for the stiff heart, HFpEF,
It's been a tougher puzzle to solve. For a long time, only diuretics for symptoms really helped. But the good news is, newer medications are finally starting to show some real promise there, too.
This quote right here is maybe the most important takeaway of all. I really want you to hear this. When someone with heart failure starts treatment and feels better, they're not cured. They're in remission. And that means you have to keep up with the treatment. It's what's holding that vicious cycle at bay and keeping the heart stable. Stopping is not an option.
And that really leaves us with one big final thought. We're getting so much better at managing this condition, at slowing it down. But is that the endgame? Or is the real future of heart care about prevention? About stopping this whole journey from ever having to begin in the first place? You know, the ultimate goal isn't just to get better at telling the story of a struggling heart. It's to make it so that story never has to be told at all.